Hello everyone, my name is Rashmi Meher. I am from Dr. Reddy's and today we are here to talk about World Head Injury Awareness Program. To discuss this, we have with us Dr. Adesh Shrivastava, Associate Professor Neurosurgery, AIIMS Bhopal. We welcome you, sir.
Thank you, Rashmi.
So as you know, we are here today to discuss about World Head Injury Awareness Program. So I would like to ask you a few questions about it. My first question to you is how head injury is different from other kinds of injuries in the body?
See, one thing which we need to understand is that the brain is the controller of the whole body. What I am today or what you are today or what anybody is today is not because of what lung they have, what kidney they have or what heart they have. I mean the physical heart, I'm not talking about the emotional heart. It is because of the personality, and that personality, that intellect, that human character is defined and governed by the brain. So once there is an insult to this brain, it's an insult to the whole personality. So this makes head injury or brain injury very critical as compared to somebody having a fracture in the in one of the bones or having damage to the liver or to any other soft tissue organ of the body. So this makes head injury a very critical and a very serious affair because it changes the person altogether. And can be very, very disabling.
So what are the common causes of head injury because of which patients comes to you?
See, the most common cause of head injury for which patients come to us are road traffic accidents and falls. And other than that, there are so many cases of assaults wherein people have fights, and these are mainly the three major causes for which patients come to us for with head injury.
And sir, according to you, which is the age group of the patient, of the people who are more at risk for the head injuries?
If we look at the most at risk age group in today's scenario, it is the young age group, the socially active age group, who is usually in the age group of between 20 to say 40 to 50 years of age, because these are the patients who are the active bread earners, earning members of the family. They drive vehicles, mostly it's road traffic accident, or they are involved in some or the other sports activity. Other than this young age group, then comes very small children who fall down, accidental falls from balconies or from terraces, and old people who usually slip in bathroom or on road due to disbalance because of poor balance. So majority cases are young patients, unfortunately, and who are the active members, earning members, and socially active citizens. They are the most common age group.
And sir, if we talk about road traffic accidents, would you tell us more about the golden hour concept?
See, the golden hour concept for road traffic accidents is that the earlier you bring the patient, the trauma that has already happened, damage which has already happened to the brain because of the impact, be it an accidental impact, be it an assault impact. So that trauma has already happened. That cannot be reversed. What happens after that trauma? There is a cascade of events. It's like a chain reaction which happens, that there is reduced oxygen supply or blood supply to the brain. There is more pressure on the brain, and this leads to further damage to the brain. So what we call as the secondary injury. So the golden hour concept is that as soon as the injury happens, the patient should be given medical attention so that this secondary damage is kept to the minimum, because every minute millions of neurons are getting damaged.
Sir, are there any complications that as a neurosurgeon you face when any head injury patient comes to you?
Yeah, there are many complications. I mean, patients have multiple traumatic injuries that have happened, which often jeopardize. Most of the cases that we are getting today are of alcohol intoxication. Youngsters under alcohol intoxication are driving, and they are ending up into severe road traffic accidents, sustaining severe injuries. So these cases are quite difficult to manage.
And sir, lastly, what would be your message to the society and your family and friends? How they can prevent themselves from getting head injuries?
See, first of all, the most important thing to prevent any injury is to prevent the accidents, and to prevent the accidents, safety rules have to be respected. If you are on the road, if you are driving, you have to follow the traffic rules. If you are walking on the road, you have to follow the pedestrian rules. If you are at home, you have to take the safety measures. The floor slipperiness has to be taken care when there are elderly people in the family. The balconies have to be made safe so that children don't just fall off them. So once you follow the defined safety rules, the incidence of accidents will automatically come down. So that's, I think, the most important message which I would like to share with the viewers.
Thank you so much, sir. Thank you so much for giving your valuable time, and I'm sure all of us will get benefited out of this. Thank you so much.
Thank you.